One of the most effective ways to begin curing backbone pain is by correcting posture and restoring natural movement to the spine. And while that might sound simple on the surface, it goes a lot deeper than just sitting up straight or pulling your shoulders back. The truth is, poor posture is rarely the cause by itself. It's the result of how we move, how we sit, and how we train our body over time to adapt to the wrong positions. We live in a world where most people spend their days hunched forward at desks, in cars, on phones. That forward head position, rounded upper back, and tilted pelvis becomes so common that the body starts to accept it as normal. The problem is, when posture shifts in that way, it puts constant mechanical stress on the spine. The muscles that should be active and supportive go offline. The joints get compressed. The discs bear more load than they were designed for. And that's when pain starts to show up, not always as a sharp pain, but often as stiffness, aching, or even burning discomfort that just won't go away. Now, the goal isn't to force yourself into some exaggerated upright posture either. The goal is to bring the spine back to its natural alignment, a neutral, relaxed position where each part of the spine stacks in balance with the others. And you do that not by bracing or forcing posture, but by reintroducing the movements the body was designed to perform. The spine is meant to bend, rotate, extend, and flex. It needs motion, not just support. When you start moving intentionally, stretching the thoracic spine, opening the hips, restoring extension through the lumbar area, you take pressure off the structures that are working overtime. You allow the discs to decompress and the muscles to activate, and this activation is key. Muscles like the deep core stabilizers, the glutes, the mid-back, when they're strong and coordinated, they hold your posture for you. You don't have to think about standing straight because your body naturally holds itself in better alignment. Another piece that's often overlooked is the way you sit. Most chairs and couches are designed for comfort, not for spinal health. Slouching in a soft chair all day with your pelvis tucked under and your back rounded may feel easy, but it teaches your spine to stay in that collapsed position. Over time, the muscles adapt. Some tighten, some weaken, and the spine loses its ability to return to neutral. That's why making small changes, like sitting with your hips slightly higher than your knees, using lumbar support, or standing more throughout the day can create big results when done consistently. It also comes down to how you breathe. Shallow chest breathing reinforces tension in the neck and upper back, but when you learn to breathe from the diaphragm, you activate deeper core muscles and take pressure off the spine. Something as subtle as correcting your breathing pattern can actually support posture from the inside out. So when we talk about curing backbone pain, we don't just look for a quick fix. We retrain the body to move well again. It's about creating habits that support the spine all day, not just when you're stretching or exercising. Posture correction is not a one-time adjustment. It's a lifestyle shift. And the more you practice natural movement, the less your body will depend on compensations that cause pain in the first place. Your spine doesn't want to be rigid, it wants to be resilient. When it comes to curing backbone pain, one of the most transformative steps you can take is strengthening the muscles that support the spine, especially the core, glutes, and back stabilizers. A lot of people hear core and think of six-pack abs or crunches, but that's not what we're talking about here. The true core includes deep muscles that wrap around your spine like a built-in brace. These muscles aren't flashy, but they're powerful. And when they're weak or inactive, your spine is left vulnerable, like a flagpole without its guy wires. You see, the spine on its own is a delicate structure. It's strong, yes, but only when the muscles around it are doing their job. Every time you bend, twist, lift, or even stand still, your body relies on those surrounding muscles to stabilize the spine and absorb force. If they're not doing that, the force travels straight into your joints, discs, and nerves. That's how you end up with inflammation, discompression, and chronic pain that seems to come out of nowhere. Now, the challenge is that most people lose connection with these support muscles over time. Sitting too much, moving in repetitive patterns, or even doing the wrong types of exercise can create imbalances. Maybe the hip flexors are tight, the glutes are asleep, and the lower back muscles are overworking to compensate. That's a recipe for dysfunction. So the goal isn't just to stretch the tight areas, but to wake up and strengthen the ones that are weak or inactive. When you train the core properly, you're not just building muscle, you're teaching your body how to move safely. Think of exercises like planks, bird dogs, glute bridges, and dead bugs. These might look simple, but when done with proper form and control, they reprogram the body to stabilize from the inside out. And the beauty of this kind of training is that it transfers into real life. Suddenly, lifting a box or walking upstairs doesn't strain your back anymore because your body knows how to engage the right muscles at the right time. The glutes are especially important, and they're often the most underused muscles in the body. Strong glutes take pressure off the lower back by supporting the pelvis and driving movement from the hips instead of the spine. Without that support, every time you bend forward or stand up, your lower back ends up doing all the work. Strengthening the glutes can be a game changer for people with chronic low back pain. It's also worth noting that you don't need to go to a gym or lift heavy weights to build this kind of strength. What matters more is consistency and control. Even a few minutes a day of focused movement where you're activating the right muscles and moving with intention can have a bigger impact than hours of unfocused exercise. It's about quality, not quantity. And over time, your posture improves, your movements become more efficient, and your pain begins to fade. But strengthening alone isn't enough. You also need balance. For every muscle that contracts, another one needs to lengthen. So as you build strength in the core and hips, you also want to keep flexibility in the hamstrings, hip flexors, and thoracic spine. It's a system. Everything is connected, and when one part is out of sync, the whole system suffers. When your muscles start supporting your spine the way they were meant to, everything changes. You feel lighter, more stable, and more confident in your movement. You don't fear bending over or standing for long periods. You start living your life without being limited by pain, and that's the kind of freedom most people don't realize is possible until they experience it. A strong spine is never built in isolation. It's supported by a body that knows how to move. One of the most powerful and often overlooked ways to cure backbone pain is by reducing inflammation and supporting the body's natural recovery systems. We tend to think of back pain as purely mechanical, something that came from a movement or posture issue. And while those are big pieces of the puzzle, there's a whole other layer underneath, and that's inflammation. When inflammation is high, everything becomes more sensitive. Joints ache more, muscles tighten, nerves become irritable, and even small movements that shouldn't hurt can suddenly trigger discomfort. What's important to understand is that inflammation isn't always visible. You can't always feel it as swelling or redness like you would with an injury on the surface of the body, but internally, it's there, affecting your joints, your discs, your muscles, and especially the tissues around the spine. And chronic low-grade inflammation doesn't just make pain worse, it also slows down healing. So even if you're stretching, exercising, or doing everything mechanically right, you might still be stuck in pain if inflammation is working against you. Now here's the good news. The body has incredible mechanisms for healing, and inflammation can be brought down naturally, and it starts with what you put into your body. Certain foods promote inflammation while others help reduce it. Refined sugar, processed seed oils, white flour, and artificial additives, they all contribute to systemic inflammation. On the other hand, whole foods rich in nutrients like leafy greens, wild fatty fish, turmeric, berries, and olive oil help cool down that inflammatory fire. When people shift their eating habits even slightly to include more anti-inflammatory foods, they're often surprised at how quickly the pain begins to ease. It's not just about reducing calories or losing weight, it's about giving your cells the tools they need to calm down, repair, and rebuild. Every bite you take either fuels inflammation or fights it, and when you start viewing food through that lens, the entire process becomes more empowering. Hydration plays a key role too. The discs in your spine are like little cushions filled with fluid. When you're dehydrated, those discs lose volume, which means less shock absorption and more friction between the vertebrae. That alone can create or aggravate back pain. Staying well hydrated helps keep the spine supple, mobile, and better protected. And it also supports detoxification, helping the body flush out byproducts of inflammation. Then there's the role of stress. Emotional stress increases cortisol, and when cortisol is elevated for long periods, It creates inflammation. It tightens the muscles, especially in the shoulders and lower back. It disrupts sleep, which is when your body should be healing. And it creates a feedback loop where pain causes stress and stress causes more pain. Breaking that loop is essential. Deep breathing, spending time in nature, meditation, or even just quiet time away from screens. These simple tools help your nervous system shift out of fight or flight mode and back into recovery mode. Sleep might be one of the most underrated parts of healing from back pain. That's when your body does its repair work. But if you're tossing and turning or not getting into deep sleep cycles, your body never fully resets. Creating a sleep-friendly routine, no screens before bed, a cool, dark room, a consistent bedtime, these small steps actually influence inflammation levels, and over time, you'll feel the difference not just in your energy, but in your back as well. And in some cases, targeted supplementation can help. Magnesium can ease muscle tension. Omega-3 fatty acids are well known for their anti-inflammatory effects. Curcumin, the active compound in turmeric, has shown promise in reducing joint pain and swelling. But none of these work in isolation. They work best when combined with the foundational habits of clean eating, stress management, movement, and sleep. So curing back pain isn't just about stretching and strengthening. It's also about restoring the environment inside your body. When inflammation is lowered and recovery is supported, healing happens faster, pain becomes less frequent, and your spine starts to feel like it belongs to you again. Pain fades when you stop fighting your body and start supporting it. Sometimes, despite all the right efforts, better posture, targeted exercises, anti-inflammatory eating, back pain still lingers. And when that happens, it's a signal that we need to go deeper. Because not all back pain comes from movement patterns or lifestyle habits. In some cases, there's an underlying medical issue or structural imbalance that needs to be identified and addressed directly. That's why a full recovery doesn't just come from doing more, it also comes from knowing what you're dealing with. There are times when back pain is a symptom of something hidden. It could be a structural condition like a herniated disc pressing on a nerve root. It might be spinal stenosis, where the spaces in the spine narrow and compress the nerves. Or it could even be a more complex disorder like scoliosis or an autoimmune condition affecting the joints. If these conditions are the root cause, no amount of stretching or core strengthening is going to fully resolve the pain on its own. You need a clear diagnosis, and that means getting the right evaluations that might involve medical imaging like an MRI or CT scan, or sometimes even nerve studies if symptoms include numbness or tingling. It's not about rushing to the most aggressive treatment, far from it. It's about clarity. Once you know the why behind the pain, you can build a targeted plan that supports healing without unnecessary trial and error. And for many people, that clarity alone brings peace of mind. It takes away the guessing, the fear, and the frustration that often comes with chronic pain. Once the root cause is understood, there are powerful, non-invasive therapies that can help restore function. Physical therapy is a good example. A skilled therapist can identify movement compensations and teach you how to move more efficiently, safely, and with greater control. It's not just exercise, it's retraining your body to function the way it was originally designed. With the right approach, even long-standing pain can begin to ease. Chiropractic care can also play a role. When done properly and with precision, spinal adjustments can help improve alignment, relieve pressure on nerves, and reduce muscle tension. It's not about cracking bones. It's about creating space, reducing compression, and allowing the nervous system to function better. That said, not every spine needs the same kind of treatment, so finding a practitioner who takes the time to assess your unique situation is key. For some individuals, complementary therapies like acupuncture, massage, or myofascial release can be incredibly helpful, especially when pain is being driven by muscle tension or nerve entrapment. These therapies work with the body's natural healing mechanisms to reduce inflammation, improve circulation, and relax the deep layers of tension that often go unnoticed. In more complex or advanced cases, a referral to a spine specialist might be necessary. But even then, the goal isn't to rush towards surgery unless it's absolutely needed. The best outcomes often come from a conservative, step-by-step approach, starting with the least invasive methods and progressing only as needed. The body is remarkably resilient when given the right support and time. And let's not forget the power of self-awareness. When you understand what's really causing the pain. It changes the way you move, the way you rest, and the way you treat your body. You stop reacting out of frustration and you start making decisions from a place of understanding. That shift can be the difference between managing pain and actually overcoming it. Because true healing doesn't come from masking symptoms. It comes from identifying the cause and addressing it with purpose.